I'm Amanda Wroblewski. I'm a licensed clinical social worker here at BCH, and I coordinate the Pillar program. We're here today to talk about this harm reduction vending machine, which is the first of its kind in Boulder County. This machine stocks harm reduction supplies, and I can get into what harm reduction is in just a little bit, but primarily, harm reduction is an intervention to keep people safer from negative consequences after engaging in risky behavior. There's a number of different kits in the machine. One I want to highlight is our safer use kit. So that's our safer drug use supplies. Because we've heard so much about fentanyl and because it's in most pressed pills or powders that are obtained on the street, we have fentanyl test strips that have instructions on how to use them. Same thing with xylazine. We're seeing that show up in the drug supply a little more often. Instructions on the back. And most of the rest of this is for if people are using injection drugs. So, 2 tourniquets. Sterile water for drugs being cooked down so they're able to be injected. Cookers to cook substances. There's about 5 to 6 in each kit. Sterile alcohol wipes to sterilize skin at the injection site. And these little bitty cottons to filter drugs through before they are pulled up into a syringe. So you might be wondering why we have installed this machine, made these items so readily accessible. The fact of the matter is, we have been in an opioid epidemic for the last 30+ years, and as a result have seen hundreds of thousands of people die. The harm reduction movement, again, is one that is trying to mitigate the negative outcomes of risk-taking behavior. So, part of the misconceptions around harm reduction is that it encourages drug use. The research time and time again disproves that people who engage with harm reduction programming are less likely to acquire bloodborne illnesses like HIV or Hep C, are less likely to die as a result of opioid overdose, and are exponentially more likely to engage in treatment and care for substance use disorders. A couple things we don't have in the machine that I do want to mention too is for folks that may be needing these items, we don't have sharps and we don't have pipes, but there are certainly other harm reduction agencies around town and around the county that do supply those items. You can find that link on the Pillar webpage, bch.org/pillar. There will also be, coming soon, maps that have that information and the hours that those organizations can be accessed as well. So this machine has been a collaboration between BCH and Clinica Family Health. It also could not have been made possible without generous support from the Boulder Rotary Club, and we're very grateful that a number of folks in our community are dedicated to the public health and safety in and around Boulder. So for anybody watching this that has questions, that's wondering more about harm reduction, how to get connected to treatment, what is out there, what does the landscape of treatment and recovery look like, please don't hesitate to reach out to the Pillar program. We will help you navigate. We will help you at any point in your recovery if you are just looking to decrease your use, or if your goal is total abstinence, if you have been in recovery for 20 years and you are still looking for support and community, please reach out. We're happy to help. This is why the program exists. We want people to get to the right care at the right time and eliminate as many barriers as we can and keep that no wrong door attitude when getting folks the care that they need.